Hello, good morning. Today, our topic is tics. Tics is nothing but a repetitive, stereotyped movement. Some people are constantly blinking eyes, or somebody is a little bit sniffing, coughing, clearing throat, or just shrugging of the shoulder, or looking this and this side and that side, or picking claws, making so many voice out like yelling, shrieking, shouting, using abusive words. Sometimes they with copropraxia, doing some sort of obscene gestures, obscene words, continuously using, or they may just go and touch, or they'll be restless, some sort of a motor restlessness. They go on shaking the legs or hands and tend to do so many activities. This will be worse when the particular person is alone. So this is quite common in young children, maybe 5 to 6 or 5 to 10 years old. Maybe up to 8% of the young people are having this sort of tics, motor tics. Some of them have vocal tics, like this usage of words and vocalization, shouting, shrieking, yelling, many things. So sometimes it can be combined. So one condition called Tourette syndrome, where the person will have an urge to speak out abusive words. So if he's tense or anxious, like in a court or in the police station or somewhere else, he blurts out so many obscenities and words, and he'll be immediately arrested and put in the jail. This is something called a Tourette syndrome. So you should be careful. So all those words who are using all the obscene words or obscenities or showing this sort of gestures may not be doing purposefully. They may have a condition called a Tourette syndrome or a motor tics or a complex motor tics with the complex motor vocal tics. This is quite common. So usually people come to me with neck pain. They'll be diagnosed to have a cervical disc, and they'll bring in a MRI with a disc prolapse. It's possible because these people, some people will have gone twisting the neck, stretching the neck, or doing sort of a continuous movement, especially when they're alone. And if you observe them closely, nothing will be there. But once he's left alone, he tends to do all sort of things, because this gets worse when the patient is relaxed. So the people will have an inner urge or tension to do all these complex motor acts or vocalization. So if you observe, I think it's quite common, very, very common. If you observe people in and around you, you can see that many people are throat clearing, coughing, sniffing and touching, unnecessarily doing or combing hair or pulling clothes or making their clearly everything. This is a very, very common. Usually said that is 8% of the population, but maybe if you look closely, it may be higher. So there are many conditions which would cause this. Like some people may be using so many psychostimulants, various medication, anti-epileptics, antipsychotics, and the other drugs like those drugs used for Parkinson's. Similarly, many conditions like autism spectrum disorder, autism, impulsive control disorders, attention deficit disorders, those with the cerebral palsy, trauma, static encephalopathy, or damage to the brain, or any ongoing disease of the brain like a neurodegenerative disorders, or a condition like Wilson's, liver diseases, or neuroacanthocytosis, Huntington's, many conditions. Sometimes there may be a seizure, like a form of epilepsy may be doing. So you should be careful of whether this could be part of an epilepsy syndrome also. So and many conditions called restless leg syndrome, or akathisia, continuous moving of the limb. So similar many conditions can masquerade or simulate this condition. So you should know that there are certain neurologic conditions like hemibalism, tics, tremor, dystonia, seizures, or myoclonus. So many things can simulate or may be associated with it. So how do you diagnose this condition? You observe the patient, you get the history from the bystander or the father or the teacher. They will tell you that the kid is quite inattentive, they'll be restless, doing so many things, or vocalize or blurts out, or use obscene words or obscene gestures. and usually they'll have all this motor symbol or sometimes complex motor or vocal tics. So the investigation usually is not required, but maybe in certain condition you may have to do a neuroimaging like an MRI, serum calcium level, EEG to look for any seizures, a thyroid level, sometimes a serum ceruloplasmin level, because sometimes this sort of many movement disorders may be presented at the outset by various this sort of non-specific movement disorders in case of Wilson's. Okay, so then once you diagnose this condition called a tics, then there are basically there are two aspects. One is a psychosocial, second is a medical. So you should have an association with a psychologist or a psychiatrist, because you have to have a behavior modification and counseling. You should tell the teachers and his parents that it's a particular condition. You have to live with it. Sometimes you can reduce it, but sometimes it may not be totally possible to avert it. In those cases, you have to tell the teachers, tell the parent, tell his friends that he is having this particular condition called a motor or vocal tics. I am sure that you must have seen many films with people with this sort of disabilities. So you should help them out in this condition. So similarly, there are many kind of drugs like various psychotics, tetrabenazine and benzodiazepines, guaifenesin, clonidine. Many drugs are available for that, but you should have extreme caution, because some of these drugs may cause a QT prolongation. That means the heart can get there can be some abnormality in the heart, especially those people with a long QT syndrome. You should be extremely careful when using drugs like pimozide and other drugs. So similarly, if the patient has got some focal tics like closing eyes or sniffing or sudden head turning, you can use a botulinum toxin to the appropriate muscles so that it can be relieved for a few months, which may have to be repeated. So basically, then similarly we can do a deep brain stimulation in refractory cases, where you take the patient to the theater and put a lead into a certain brain nucleus so that it can be averted. But this is not a usual practice. Usually it's observation, counseling, biofeedback, and drugs and counseling. These are the most important. And some drugs are especially, I find the benzodiazepine in low dose extremely effective in this case. Similarly, you have to treat the underlying condition like the obsessive compulsive disorder, hyperactivity disorder, or if there are any hyperthyroidism, Wilson's, or any other neurometabolic, neurodegenerative disease which can occur along with this. So you have to dissect out which are all the condition accompanying this particular motor tics or vocal tics, whether it's it's a continuum or whether it's a expression of another disease. So you have to treat the underlying condition or the condition which would exacerbate like a hyperthyroidism or an occult disorder like a Wilson's. So let me conclude here by telling you that tics is quite common. You should look out for the tics in the community, and if people come to you with the disorder, don't diagnose disc disease. Those who go on shaking the neck like that, it's quite common, and he'll be branded as case of a cervical spondylosis or a cervical disc. So you should tell them, and you have to have a appropriate behavioral modification, and it's eminently treatable. And if you know that, and you can tell the parents as well, the teachers, that the particular kid has got a motor tics or a Tourette syndrome, so it would help in a long way. Okay, thank you very much.